Hello, stakeholders. My name is Ebel Onyanuse from Brandman University. The purpose of this video is to present to you an evidence-based practice project plan in healthcare setting that requires the ability to effect change. The purpose of my CSP intervention is the impact of using educational brochure to teach blood sugar control among middle-aged African American diabetics. Identification of stakeholders. My key stakeholders are patients, providers, payers, pharmaceutical firms, and policymakers. Brief description of stakeholders. Patients are the recipients. Physicians are the providers of medical care. Health insurance sells health coverage plans directly to patients and or indirectly through employer or governmental intermediaries. Pharmaceutical firms develop and then market medications which are prescribed by the doctors to treat patients. Government subsidizes healthcare for elderly, the disabled, and the poor. The role of each project implementation. Policymakers. Policymaker is a synonym for Department of Health or government responsible for the health of the population. They establish the framework within which healthcare is provided to the individuals. The policymakers aggregate data from patients, providers, and payers to develop population level metrics that inform their health and health economic policies. The crucial questions are answered in these policies, which are what is eligible to receive, who is eligible to receive, what care services are provided, how, where, and by whom. How are services paid for? Are the services being delivered well? Are they accessible? Are the needs of vulnerable or marginalized populations adequately served? Are the needs for vulnerable or marginalized population adequately served? What healthcare concerns do we need to plan for next? Patients. Patients have ethical duties over their health and towards monitoring costs. It is reasonably assumed that healthier lifestyles will lead to lower healthcare costs. In view of this, companies like Walmart with World Health Organization have stopped hiring employees that smoke to reduce healthcare-related costs. Sometimes, MDs are accused of over-recommending diagnostic tests. However, this practice may be as a result of patients demanding multiple tests, even if some of them are not necessary. The interesting thing with patients is that as technology increases, patients with insurance want the newest, most advanced, and expensive treatment that their insurance may not cover. Physicians sometimes succumb to these requests. Providers. Providers operationalize care delivery within the policy framework. They provide health services to patients and maintain health information about them. The providers coordinate patient care with other providers as care team members. Many providers are independent and manage their own operations and finances. Physicians have an obligation of beneficence to do whatever is necessary to benefit their patients. Payers. Payers operationalize the financial elements of the policy framework. They enroll patients as beneficiaries and procure care services from the providers on behalf of their patients. They also must take on the task of ensuring the financial sustainability of the care program and report to the policymakers. The pharmaceutical firms. Pharmaceutical firms develop and market medications which are prescribed by the physicians to treat patients, while government subsidizes healthcare, whilst government subsidizes healthcare. Educational theory and conceptual framework. Use of educational brochure in teaching diabetic control have utilized different patient educational theories and strategies that have been well described in the literature. This conceptual framework has highlighted strategies that can be used in different healthcare or community-based strategies, including informational learning opportunities, cultural relevant problem-based awareness, and ongoing support for sustaining blood sugar control among African American diabetes that are currently undergoing treatment. Each of these three programs may have had a different context, format, or primary goal. However, they are all found as the empowerment approach to diabetes education and are designed to meet individual patient needs while taking advantage of the experiences of group of patients to provide support and assistance to each other. Educational intervention. Using educational brochure to teach blood sugar control among African American diabetes is recognized as fundamental component of diabetes care. The goal of educational brochure is to help patients acquire the knowledge, information, self-care practices, coping skills, and attitudes required for the effective self-management of diabetes. Several reviews and meta-analyses have found educational brochure use to have a positive impact on overall health, including psychosocial stability of the patient. The impact is specifically pronounced in diabetes knowledge and improving blood sugar monitoring, dietary, exercise habit, food care, medication compliance, coping, and overall glycemic control. Implementation plan. The use of educational brochure in teaching blood sugar control has been implemented using a variety of methods. It has been found to be effective and improving diabetes management outcome. Tang et al. 2015 demonstrated that the use of brochure as economical as educational use is more cost-effective, resulting in greater treatment satisfaction, and is exceedingly easy in promoting lifestyle changes. Providing diabetes education is Providing diabetes education by certified diabetes educators using appropriate technology such as brochure can improve the quality of life of the patients. Here are my references. Attached is the sketch. Thank you.